Good evening. My name is Cornelius T. Brown Jr., and this is my presentation for my MSc in Capstone, Bridging the Gap, Reducing No-Shows, Nurse-Led Quality Improvement Project, conducted at TCA, Chicago, Illinois. All Aspen University students are required to abide by Aspen University's academic integrity policy, as outlined in the university catalog. The academic integrity policy is built upon the concepts of honesty, truth, fairness, respect, and responsibility. By taking this assessment, I agree to abide by both the academic integrity policy and the rules outlined on this exam. With this recording, I am attesting that I have personally completed the comprehensive assessment and that the information I submitted is true and accurate to the best of my knowledge. Again, this is my identification. Welcome and thank you for attending my capstone presentation. Today I will be presenting my project titled Bridging the Gap, a nurse-led quality improvement initiative implemented at TCA, a federally qualified health center in Chicago. This project addressed primary care no-show rates, which reached 40% before intervention. I will walk you through the project rationale, goals, methodology, findings, and recommendations while highlighting how nurse leadership and system-based improvements significantly enhance appointment adherence and quality of care. The project centered on implementing a structured communication-based intervention to reduce an extremely high no-show rate. A nurse-driven verification checklist was embedded into daily workflows to ensure contact information accurately and consistent patient reminders. By improving data and accuracy and standardizing communication, staff could better engage with patients before appointments. EMR data provided the baseline for pre and post intervention comparison, enabling a clear evaluation of progress. The rationale for this project was rooted in the widespread consequence of missed appointments, which disrupt care plans and worsen chronic disease outcomes. Research indicates the national no-show rates between 19 to 42%, but TCA's health rates were much higher, significantly affecting efficiency and financial stability. Patients in underserved communities often experience unstable housing and inconsistent phone service, leading to communication challenges. These somatic barriers reinforce the need for structured nurse-led intervention. This project aligned closely with the Institute of Healthcare Improvement's Triple Aim framework, focusing on improving patients' experience, population health, and cost efficiency. Additionally, it supported transformational leadership principles by empowering staff, promoting accountability, and fostering a culture of shared responsibility. By standardizing communication processes and reducing workflow inconsistencies, the project aimed to create lasting improvements. As a nurse leader, I entered this project hoping to develop stronger system thinking skills and practical experience in quality improvement methodologies. I expected the project to help me refine communication strategies with team members and patients, while sharpening my skills in collecting, interpreting, and applying data to real-world challenges. This initiative also aligned with my long-term professional goals in nursing administration and process improvement. Another expectation was becoming more comfortable collaborating across disciplines, including providers, medical assistants, and administrative staff. I also hope to contribute meaningfully to help quality in the community by improving reality of care. Those MRI reports and follow-up audits, I gained deeper familiarity with data-driven decision making, and change management, skills critical for nurse leaders in modern healthcare settings. Primary goal was to decrease the no-show rate to 30% within 8 weeks. Additionally, additional goals included improving workflow consistency, ensuring accurate patient contact information, and enhancing patient engagement through education and communication. These goals supported a broader objective of improving community access to timely, continuous care. The literature revealed that no-shows remain a pervasive issue across healthcare systems, contributing to fragmented care and worsening health outcomes. Underserved populations, particularly those seen in FQHCS, experience disproportionately high no-show rates. Studies consistently attribute these challenges to some somatic factors such as a limited transportation, financial strain, and a communication barrier. Multiple studies show that appointment reminders, particularly SMS-based systems, significantly reduce no-show rates. Accurate contact information plays a central role. Without it, reminders fail before they begin. Research has also explored predictive modeling using machine learning to identify patients at high risk for no-shows, reinforcing the importance of data accuracy. While telehealth has lowered barriers for some populations, in-person care remains essential in primary care settings. Evidence shows that FQHCS experience some of the highest no-show rates due to socioeconomic barriers and resource constraints. These missed appointments increase operational costs and disrupt care continuity. Staff morale is also affected due to inefficient scheduling and repeated outreach attempts. Literature supports the use of nurse-led interventions in addressing structural and communication barriers in community settings, reinforcing the foundation of this project. The theoretical framework of the project was supported in the literature. Donovan's structured process outcome model emphasizes the connection between system design, workflow processes, and the patient outcomes. Studies also highlight the effectiveness of transformational leadership in improving staff management and organizational culture. These frameworks strengthen the foundation for the project's design and implementation. The project procedures began with staff training on the verification checklist and its integration into existing workflows. Implementation ran for 8 weeks. Weekly audits ensured consistency and allowed for quick identification of barriers or areas needing reinforcement. MR reports were generated weekly to compare pre- and post-intervention no-shows trends. Findings indicate immediate improvement in contact information accuracy and consistency for patient communication. Staff adherence increased steadily as training and workflow reinforcement took place. As a result, the number of unsuccessful outreach attempts decreased, and more patients confirmed upcoming appointments. The key outcome was a reduction of the no-show rate by nearly 20%, 20 percentage points within an 8-week period. This was a substantial improvement that brought the clinic close to the target rate. The improvement was consistent across multiple provider schedules, indicating that the intervention was effective clinic-wide. Feedback gathered from staff reviewers highlighting that the checklist was simple and beneficial. Many suggested integrating it directly into the EMR via a mandatory hard stop. Patients appreciated the increase in communication, especially those with chronic conditions. The main barrier indicated with occasional workflow delays during peak volume hours. Reviewer feedback was consistent with literature showing that standardized communication and structured outreach improved appointment adherence. This project demonstrated the need for ongoing audits and reinforced training. These findings support broader scalability and the lay of the groundwork for expanded patient engagement solutions, including multilingual materials and automated alerts. Future recommendations include automating the verification checklist using EMR hard stops, translating materials to improve health quality, and reinforcing staff education. Dissemination will include presenting at nursing leadership conferences, developing posters for quality summits, and exploring publication opportunities. This project also was potential to evolve into a DNP level initiative. In conclusion, this project demonstrated that simple, structured nurse-led interventions can significantly reduce no-show rates in community health settings by improving data accuracy and strengthening communication. The clinic enhanced both efficiency and continuity of care. This initiative successfully supported health quality, staff engagement, and organizational sustainability, laying the foundation for future improvements. These are my references, and thanks for listening. This is also my screenshot from my documents I recently uploaded into Project Concert. Have a fabulous evening. Thanks again.